Okay, we're doing a very basic and therapeutic warm-up and stretching. This is Izzy. She's going to help us out. Lay all the way down on your back. We begin with what's called pelvic tilting. We're moving the spine and imbibing. So you inhale and lift your low back off the floor. Exhale and imprint. Try not to use your legs. Only use the abdominal muscles. Inhale and arch, lengthening your abs. And exhale, imprint your low back. No weight on your feet. Inhale, arch. And exhale, imprint. And one more time. Inhale, arch. Don't lift up in your chest, just from your waist to your tailbone. And then come back to neutral. Internal obliques from the hip bone towards the midline. Draw it in on one side and hold it, recruiting as much muscle fiber as we can. Then release, and the other side, from that hip bone towards the midline. Hold. And release. Left side, pull in, keep your ribs pulled together, relax your neck and shoulders, concentrate on that lower quadrant, and then release. Again, don't push on the floor. Exhaling as you get the muscles to engage. And release. One more time on each side, keeping the ribs pulled in. Concentrate on that one spot. Last one on the right side. And back to the center. Now a circle pattern. Inhale to your tailbone. Exhale as we go around to the right hip. And then we come center, crossing the iliac. And then the left hip, and you start arching your back when we inhale. Go around again. Try to make that circle nice and smooth. And last time, this is 3 circles. Imagine that you're pushing your pelvis and low back into a circle that's on your mat. Change directions counterclockwise. Exhaling about 3/4 of the way around the circle. And inhale. Exhale as you start your circle. Excellent. And one more time. Okay, so we have a straight spine, level hips. Maintain that natural curve in your low back by pulling your abs in. Lift your heels, and then you bring one knee up. Set the toes lightly to the floor, and then the other side. Focus on your torso strength. And that as you bring that knee up, there isn't any rocking in the pelvis. So you're resisting the pull of the leg and maintaining the pelvis and low back. And one more. Then slide your legs straight on the floor, flex your foot, then drag your heel on your mat to bring it back. And then the right leg, extend, flexing your foot. Drag your heel on the floor. Now the reason we're dragging the heel on the floor is to minimize the work in your leg, focusing on stabilizing in the torso. Extend and flex. Minimize the work on the leg. Be very aware that your hips stay level as you're moving, and it draws in. Open your knees apart, and together, and apart, and together, and apart, and together, and one more, apart, and together. Walk your feet to the edges of your mat, and then let your knees come to the middle. Just holding here, letting your hips stretch and release. After a couple of seconds, we'll increase the rotation. So drop your left knee down just a little bit and reach up with your left arm, getting a stretch all the way down the side of your torso and into your leg and thigh. Take a big breath. And bring the arm down to release the stretch. Switch legs and reach up with your right arm. Nice big breath. Okay, releasing the stretch. Bring your arm down to your side. Bring your legs back into the center. Slide your left leg down. Flex your foot. And then open your foot to the side and together. Again, not letting anything else move in your torso. Put your fingertips on your hip bones in front and your thumb at the rib cage and make a frame there that's not going to move. One more time on the left leg. And then bring the leg back in. And then we'll extend the right leg straight, flex your foot. Carry it to the side, and together, and apart, and together, and 3, together. 2 more, 4, and 5. All right, we're going to bring the right knee back in, extending both arms straight up to the ceiling for shoulder placement. Remember, we're isolating just the shoulder blade leaving the floor and then press down flat. Alternate to the other arm. So performing one arm at a time with your full concentration, making sure that you press your shoulder blades flat and open across that clavicle. Keep both shoulder blades pushing firmly in the mat. And then open your arms to the sides, apart and together. Feel like you're pushing your shoulder blades into the floor and your arms just float up. Exhaling, return, and again, exhale. And then we lower the left arm down towards our leg. As you do that, make sure your shoulder doesn't roll up. Then repeat the right arm, straight down, up to the ceiling. Left arm again, down, and up to the ceiling, and right. You're also holding your abs with enough tension that there isn't any movement there. And you'll notice that more on the overhead reach. Because when we lift our arm up, the ribs want to lift. So push those ribs down. Use your latissimus dorsi here to press into the floor, returning your arm up. Okay, and then we'll try both arms overhead, increasing that workload a little bit. Don't let your back arch off the floor. Then we're going to add a little half roll up, so tummy tuck and lift. 1. And lower. Add the overhead reach. Don't let anything else change. Shoulders have to stay down. Chin to chest, we lift 2. Are your shoulders flat? Good control. Take a breath in. Exhaling 3. Shoulder blades flat. And reach. Here's 4. 5. And 6. And 7. And 8. Keep the shoulders open as you lift from the mat. Be aware not to hunch. 9. And 10. Okay, let your neck recover. You can turn your head from side to side. We're adding a little stretching. Bring in your right knee, lift it up towards your shoulder. Slide the left leg down straight. Flex and point on the left foot. This ankle pumping increases circulation, releases lymphatic fluid and helps that circulate. And also there is a neurogliding or flossing of those nerves. Extend your right leg straight up for a hamstring stretch. Then gently pull back into a flexed foot and point. Make sure that left leg stays flat on the floor. So if you're relaxed, it might buckle a little bit. Keep extending it, pressing your thigh to the floor. Adding in 5 ankle circles. 1, 2, as big of a circle as you can. 3, 4, and 5. Changing directions. 1, and 2, 3, 4, and 5. Pull your knee in high to your shoulder, and then extend the leg straight through to stretch. Keep your foot on the ceiling as you bend your knee, and then press into your hands to get the biggest stretch you can. Knee to chest, and extend through, and one more time. Pull it in, and press through. Put your left foot on the floor, tuck your right knee high, and we rotate to the left, reaching out with your right arm. So we're in a rotation now. Open and close your right hand. Want that shoulder to be stretching, and again, this is a neuroglide activity. And then turn your palm down to the floor and extend that wrist up. Pumping up and down. You might feel a good stretch in front of your elbow. Turn the palm to the ceiling. And then we're going to open this right knee up. And we're back to neutral pelvis again. Bring in your left leg. Pull up high towards your shoulder. Slide the right leg straight. Add the ankle pumps on your right foot. We'll add in the hamstring stretch on the left leg now. Extending the legs straight to the ceiling. Just a reminder, you can always bend your right knee if you need to take some pressure off of your back. Flex and point. Pulling those toes back increases the stretch behind your calf. And then we'll circle the ankle 5 times. 2, 3, 4, 5. Changing direction. 1, 2, 3, 4, and 5. Pull the knee up high to your shoulder. Then extending straight. Follow through the toes. 1. Flex and pull back. Keep that right leg on the floor. Extend through 2. And pull back. And 3. One more time. 4. Right foot comes to the floor. Left knee bends so your knee is high. And we rotate to the right with the left arm stretched straight out. We'll stretch on the shoulder here. Open and close your hand. Then turn the palm down to the floor and extend back at the wrist. We're going to turn the palm up to the ceiling. And then open your left knee and let that pull your pelvis back to neutral again. Engage your abdominal muscles. One foot comes up at a time to chair position. Don't allow your back to arch. So you're supporting the weight of the leg. And back up to chair each time. 2. And 2. Take a big breath. 3. Pulling in with those abdominal muscles. Notice I come back up to the chair position, start and finish. There's 4 sets. 5 and 5. 6 and 6. Isometrically contracting the abdominal muscles. Relax your neck. 9 and 9. One more on each side. 10 and 10. Hold chair position. Add a half roll up. Extend your right leg. Pull in with the left. 1. Switch sides. Flatten the abs. As you extend your leg, tighten the thigh. There's 3 and 3. 4. Extend your legs straight and tight. Are your shoulders down? 5. You can always support your head if you need to, or even put your head on the mat. 7 and 7 and 8 and 8. 9 and 9. 10 and 10. Tuck your knees in, lay your head back down to the floor. Relax your neck, and then placing the feet to the mat. We're going to bridge. Remember, we initiate with the pelvic tilt, pushing your spine to the floor. Peel off one vertebrae at a time. Don't go too high up on your neck. And then we come back down one vertebrae at a time. Inhale and arch when you're on the floor. Exhale, imprint, starting with abdominal support, pressing the spine into the mat, squeeze your glutes, and lowering down. Just 2. And roll up 3, peeling one vertebrae at a time. And lower. Try to take your time to find the flat spots and work on articulating each vertebrae. And roll down slow. Inhale and arch at the bottom. Exhale, press your spine into the mat. There's 5. Pulling your hips towards your heels as you descend. And 6. Lowering slow. Inhale, arch. And 7. Lowering slow. 8. Bone by bone, take a breath. 2 more to go. 9. more time is 10. Bring one knee in at a time. And let your hips pull off the floor so you gently stretch your back. And place your feet to the mat. If you can do a full roll up, otherwise roll to your side.